There are definitely many moments in which medical doctors have been alleged or even influenced by pharmaceutical sales reps to prescribe medications to people who didn't necessarily need them, meaning that there's been a lot of off-label marketing. And what that means for many of your viewers is that if a drug is approved for, let's say, depression, and the physician prescribed it for someone who has OCD, obsessive compulsive disorder, that would be an off-label use. And there's just so many doctors out there who are prescribing in that manner. A lot has been done by the FDA to kind of curb that, curtail it down to a bare minimum, but it's still going. And it's a risk that the medical doctor takes, as well as the patient. The patient's doing it in the trust of the medical doctor.
Right.
Yeah, so being a drug rep within the doctor's offices, it's kind of depressing too, because you walk in and there's a whole waiting room of sick people.
Yeah.
People that you just know are not getting well, and then of course you walk in there thinking about the potential that, oh, I could totally see these 3 people here who are sobbing, crying, looking totally down in the dumps are going to be ready to be prescribed my drug, and I would go in. And they taught us to identify personalities. And medical doctors, they taught us to immediately identify, is the medical doctor someone who's a director type, a clinical type, a social type, or a relator type. The clinical types are very much into the studies. Now, one thing a lot of people don't realize is that these clinical studies, they're actually conducted by companies in which the pharmaceutical companies hire out, or sometimes they'll be done internally. And so they're completely configured in order to support the drug to look better either than a competitor drug or the placebo. What a lot of people don't realize is that a lot of the clinical studies that showed the sugar pill worked better than the drug are actually not even published. Because why would a drug company want to spend money publishing a study showing that the sugar pill was more effective than their product, right? You know,
And some of the subjects had suicidal thoughts and actually stopped taking the drug. They had to drop out. And so in the results, I guess they said they dropped out because, no, they called them non-compliant. Yeah, they were having suicidal thoughts. What are you gonna do, just keep them in the study? Yeah.
Right, and instead, and by defining them as non-compliant or a defective candidate in the study, we should recategorize them as someone who had a severe side effect from the drug. Because if you look at Hippocrates.com, and I lecture to holistic doctors nationwide on how to identify the actual side effects of different medications that their patients are on, most of the SSRIs and the antidepressants, you'll go and see the serious reactions. Being suicidal is actually at the top, you know. And to say that someone's suicidal from the depression or from the drug becomes it's very gray as to what is actually causing the person to commit suicide, and no one's holding the drug companies accountable, unfortunately. I know, it's an amazing healthcare system that I unfortunately was part of, but I got the inside look, and now I'm outside of the system trying to help everyone, you know, attain health and try to do that without these pharmaceuticals. And
Gotcha. You mentioned Hippocrates.com. You also talked about a book in your book called Drug-Induced Diseases. What is that?
Yeah, so the phenomenon of iatrogenesis has been known, gosh, well before 1962. In fact, the very first book published on drug-induced diseases, so diseases caused by pharmaceuticals, was published in 1962. And I purchased those copies. You could find them at a library that's looking to unload them. And what's interesting is before a drug is published, it has to be, you know, that phenomenon has to be confirmed. So well before 1962, this phenomenon has been occurring. Now, I also have the 2005 edition, which is literally 800 pages, and I have the 2010 version, which is now close over 1,000 pages. So the list is just growing and growing and growing. Unfortunately, a lot of people out there have heard about the Vioxx drug recall. In 2004, this drug was recalled because it was known to cause between 25,000 to 55,000 actual deaths through the increase of heart attacks or any type of cardiac events. However, Vioxx was not the last drug pulled off the market. There have been so many drugs pulled off the market since then, which means that unfortunately when someone is prescribed a new medication that just got launched, they're still part of the clinical study. It's called phase 4 trials. It's let's see if it's safe even after we launch it. And so I typically ask, people, it's like, would you like to be the person who puts on a bulletproof vest for me to test it to see if it's effective or not? And it's like, I don't know if I want to be that person.
No, you don't want to be that person. Yeah. So what is at the core of reversing depression and depression-like symptoms?
Yeah, to get to the core of reversing symptoms of depression, it's really important that people focus on stabilizing their blood sugar. Moving towards a Mediterranean diet, a paleo diet, a primal diet. If you look at the native societies that Weston A. Price studied, and those that had absolutely perfect health, none of them had depression. And if you look at,
you know what, just real quick, talk about who Weston A. Price was.
Okay.
Yeah.
So Dr. Weston A. Price was a dentist in the late 1800s, early 1900s. And he was treating the moms and dads of a generation, and very few of them had cavities, very few of them needed braces, or they actually could grow their wisdom teeth out. And then he started treating the children. And he noticed the children had narrow dental arches, so they needed braces. Their wisdom teeth would grow in crookedly, so they had to be cracked and extracted. And they would have a lot of cavities as well as a lot of systemic health issues. And he believed that, these health issues are not being passed down from the parents, but instead the change in the dietary habits. And he noticed that the kids of that generation were now eating more processed foods. And he heard of a society that had absolutely perfect health. And so he sold his practice and he traveled the world, and this is the early 1900s, and he conducted a total, around 100 different ethnographies, living with different native societies and studying what they were eating in their lifestyles. And none of them were consuming processed foods whatsoever. They were eating organ meats, they were eating herbs, they were eating fermented foods, they were eating a lot of vegetables. And he realized they didn't have depression, they didn't have cancer, they didn't have hypothyroidism. And so he attributed that the cause of any modern day chronic illness is really due to some form of malnutrition. Now, more importantly about his work was when he went to Tonga, he studied the Tongans who were out in the oceanic islands, very far from Europe. He would notice that Europeans would travel by boat all the way down to Tonga. And in order to get coconut, they would exchange white flour, white sugar. And so then this coconut would be brought back to Europe and then sold on the retail markets. Now the problem is that that's a long trip.
Right.
And so overall then, what happened was the price of coconut dropped. So these Europeans no longer would travel to Tonga. Now these kids in Tonga were perfectly healthy before these Europeans came by. As soon as they started eating the white flour and the white sugar, they started developing cavities.
Right.
They started developing systemic health issues. But then when the Europeans stopped coming, the kids no longer had their sugar available to them. And they started going through withdrawal. They're kind of like tweaking out here and there. And then all of a sudden they started getting hungry. They're like, I gotta eat something. And so they went back to eating the native foods, the liver, the organs, the tissues, the herbs. And Weston A. Price noticed something that's not even talked about to this day among the medical society. But these kids, their cavities reverse themselves. Their health issues reverse themselves. So he not only confirmed that most chronic illnesses today we see in society are caused by malnutrition, but it's also reversible with nutrition. Every individual is different and every drug is different. And that's where it's important that anyone out there who's really interested in becoming healthy and unmedicated works with a holistic practitioner very closely, as well as the prescribing physician very closely, and to be patient and to do everything, you know, within their power. And so that's how I help pretty much people who come to my clinic to getting healthy and unmedicated.
Nice. So 6 months of nutritional support
At least.
before trying to get off the medication.
Yeah. Now, in some situations, depending on the drug and depending on the scenario, we'll do it right away.